All right, let's go back. We are live. Hello, everybody. Greetings to you all. My name is Pam Grace, and I am the founder and CEO of Discover You Health. And today we are having another edition of Health Talks. Health Talks is a beautiful platform that I've created to help engage ongoing conversation on health and various aspects of health. More importantly, we want to share resources, information, and create more visibility around Black clinicians, Black health providers, and also create solutions and for having improved health. So without further ado, you know what I mean? I want to introduce a beautiful lady that we have. We have beautiful Dr. Jasmine Abrams. I will allow her to introduce herself. But before I do that, we're both wearing green. Ladies in green. So please, Jasmine, or how you want me to call you today? Dr. Abrams? Dr.
Whatever you feel comfortable with, Pam Grace, it's up to you.
Okay. All right. So Dr. Jasmine Abrams is here with us today. Please introduce yourself, share a little bit about your bio, who you are. Oh, before I start, the topic today is chronic disease, HIV/AIDS, and COVID-19. Okay, and that's why she's here. She's going to share her insight on that topic. So please, without further ado.
Greetings, everyone. I am Dr. Jasmine Abrams. I am an international behavioral research scientist based currently in Boston, Massachusetts. I'm an assistant professor at Boston University and affiliate faculty member at Yale University Center for Interdisciplinary Research on AIDS. I've been in academia for at least, going on about 15 years now. The time flies, but my research primarily focuses on advancing health equity for women of African ancestry. And I do that by examining cultural factors and other sociocultural factors that influence health behaviors and health outcomes. I've just started sort of making my way into the healthcare system. I was previously more community-based, but I'm starting to do more work in the healthcare system and looking at other more innovative ways of delivering healthcare to Black women domestically and globally. I'd say most of my work has focused on HIV prevention, but I've also worked in some other areas of chronic disease, including examining cardiovascular disease risk and prevention as well.
That's so awesome. And you know, the funny thing is we have that similarity as far as like community advocacy. I used to be a peer educator back in the day. That's how I started in health and health advocacy through Bowie State. So I did a lot of like HIV/AIDS, STIs, things like that. Not a clinician, of course, but definitely a true health advocate to myself. And that continues to spark my love for my organization, the Pulse Project, Discover You Health, and also I've actually been watching you for some time. Actually, yes. I don't want to sound like a creep, but I always try to keep my eyes out for who's doing what's happening, staying connected with again HIV/AIDS research, women's advocacy, things like that. So I'm very proud of the work that you've done and your contribution to us. And when you said like ancestry work as far as our historical relevance and how that ties into us now and today and just how everything is intertwined. Again, I really appreciate you and your work. One of the questions that I want to start out with, as an international behavioral research scientist, educator, and entrepreneur, you've had the privilege of studying and working internationally and domestically. How would you assess COVID-19's impact on humanity and overall health?
Yeah, I mean, I think it's hard not to see the impact that it's having both at an individual level, national level, and even international level. We see it and feel it, most of us at least, because we're in our homes much more than we previously were. We're disconnected, at least physically, some of us, from family members or friends or colleagues. A lot of us are not going to places that we normally would go, engaging in activities that we normally would engage in. So on some level, even our coping mechanisms in a way have been disrupted, if you will, by COVID. And another sort of way I see this influencing us, and outside of the sort of obvious influences on our health, right? It's a virus that attacks our immune systems and the respiratory system, making it hard for people to recover. So outside of those, thinking about living life during a pandemic and, trying to cope with that, it makes it very hard to engage in your maybe natural coping mechanisms with all the restrictions that have been placed on us with regard to social distancing, and some of our favorite places being closed or operating differently. And then on top of that, I know for me, one of my favorite coping mechanisms is travel. And just in addition to coping, like just sort of resting and relaxing and resetting. And so I haven't been able to travel for leisure, but I also, like many people, haven't been able to travel for work. So there are a lot of research studies that have been completely halted because of COVID and the risk of traveling internationally. For example, my work is funded by the National Institutes of Health, and they have a moratorium on international travel for your research, domestic travel even. So thinking about what that means for advances for other illnesses and conditions, like all of those things are being slowed. And I would say, just as a normal human, I've like sitting at my desk more than normal, like most. And then also, like I've been getting like pains and aches in my hips and back, like things that haven't been hurting before from all the sitting are hurting more. And it was very challenging to enter into the healthcare system for something other than COVID, especially in March, April, even May. I would say that started to change around June. But in some areas that still is the case. If you don't have a COVID or life-threatening emergency, it's hard for you to get healthcare for other things, including mental health, including like non-emergency surgeries, dental health, sexual and reproductive health outside of women who are pregnant or giving birth. So a lot of other aspects of our healthcare are not being attended to because the country is literally trying to grapple with the emergency of COVID.
Wow, what you just said is the overall impact in health in general. Like you said, like the delayed response, right?
Right.
To
Yeah.
other health concerns that are still very valid and still need attention, but it's like the priority has been shifted. So what do you do now when you do have what you feel in your heart that is an emergency or that needs attention and no one is attending to you? You have people that are dealing with ongoing chronic pain or like you said, immobility issues or
Right.
inability to access even just information. Like, hey, like, what is some advice? I'm okay, right. I don't have to go into the doctor's office today, but can I at least speak to someone? Can I speak to someone that I know that knows my health history and charts? And so that's also can be very struggling or problematic when you're trying to at least get access to adequate consultative support, even if it's not that direct interpersonal exchange.
Yeah, and I think telehealth has definitely helped to ease some of that, but everything can't be managed or addressed via a telehealth appointment. Like I remember a few months ago, I had an appointment with a dermatologist and I was trying to describe to her what I was feeling and seeing on my skin and trying to put my arm up to the camera. And, it's the images are grainy and it's just, you don't always get the same exact experience when you're doing a telehealth appointment. And some things are not appropriate for telehealth, like, for example, a dental cleaning or dental surgery. We can't do that via telehealth.
Yeah. No, definitely. That's we're all just managing
Right.
our health needs or figuring out other methods to cope, as you mentioned, like various coping mechanisms are not accessible or not even an option, right? So coping with that, with the reality that that's not, that, you know, your to-go-tos are no longer there is even another issue within itself, right? And you mentioned mental health. And I know a lot of my friends are in the mental health field that are extremely overwhelmed, right? With the backlog, the people on wait lists, you know, trying to hire adequate professionals, train them adequately is just a big gap, you know, trying to fill the demand, the healthcare demand. So there's been a lot of misinformation, some may think. So when it comes to like leading organizations such as the CDC or WHO, many people may say they have lost a level of credibility and just general public trust due to contradicting information in regards to COVID. Like, what is your advice to people in regards to like navigating information from what we deem as legitimate government sources or health sources, but right now they're in question? How do we navigate that when it comes to, you know, dealing with our health?
I hate to hear that that's the case. These are definitely trusted sources of information for me as a scientist. World Health Organization, CDC, Centers for Disease Control and Prevention, NIH, National Institutes of Health, and all of the subsidiaries. So I'm really sad to hear that, but I completely understand because I have seen, like everyone else, the information change over months. But one thing that I would love to point out is that, you know, especially right at the beginning when we were first hearing about COVID, the terminology was novel coronavirus, which means we don't know anything about this. It is new. All of the studies that are coming out are literally, you know, they are just being done. They're being fast tracked to publication. So it's just like, you know, I would liken it to, this is an oversimplification, but dating someone. You meet them and it's like, oh, you know, you're telling people about them. Oh, this is what he does. This is what she does. This is how they are. And then a few months down the line, it's like, oh, wait, that thing that I told you before is different. They're not doing that anymore, you know? So it's like you're learning more and more information. And that's the same thing that's happening with science. The more research that's being conducted, the more that we know. And sometimes I think early on, there were a lot of suggestions or guidelines that were being given based off of what we've seen with other viruses, based off of the minimal science that existed at that point. But as we continue to go on, the science is getting more and more grounded, more and more firm, more and more stable. And that'll continue happening over the next few months and even years with this particular virus. So I would say still rely on and trust in. Those are going to be the most trusted sources of information. World Health Organization, CDC, NIH. They are just grappling like everybody else, trying to learn as much as possible about the virus and share that information as rapidly as possible.
So in other sense, we need to be gentle with them and not such harsh critics. And I think, you know, when you're looking for information and there's a need, we're expecting someone has to have the answer. So I think it's a little frightening when the experts don't have the answer. It's almost like your parent that you deem as a hero, or, you know, you have such high esteem for them, and then something happens and you need them and they're like, I have no answer. And you're like, wait, I thought you knew. And so it's almost like I don't say lose trust, or maybe like your trust is lost in that moment and you just kind of have to rebuild, or you have to also understand that they're human as well and humanize them and kind of take off that big superhero pressure, you know, that we may put on people, or expectation that we may put on these big public health or these big institutions. And so that is something that we have to, I think, as the public, be mindful that, oh, I don't know who. Sorry, I need to remove that person. My bad. But we need to be mindful that science is evolving, and I think there needs to be clear interpretation or clear communication or ongoing communication that, hey, we're still trying to gather information, be gentle with us, and just that honest transparency so that we can hopefully be more understanding through the process as science is working its way through. And I think also when you mentioned coping mechanisms with our life changing so much, it's just so hard to be as patient. You know, it's like you want an answer like now. And
absolutely. Yeah. I definitely, excuse me, definitely understand that sentiment, wanting to know what do I do to protect myself, my family, my loved ones, to be a better citizen. But like you started with, we're human, and science is imperfect. I trust science. I believe in the value of science, but the reality of science is that it's conducted by humans and we're imperfect. We get better and better with more iterations in terms of the science, but again, we're imperfect, we're human, and so there will be some margin of error with all science.
All right, spoken like a scientist. Oh, perfect. So I just want to talk a little bit about stress. So allostatic load is the wear and tear on the body, which accumulates as the individual is exposed to repeated or chronic stress. So as we look at African-American women who suffer disproportionately from chronic stress, chronic disease, racial discrimination, can you just explain a little bit of like how all that is connected?
Yeah, so I'm gonna tell a quick story. I remember when I was in graduate school, I think I took a class called Culture, Race, and Health. Mm-hmm. And one of the papers that we had to read talked about how on nearly every indicator of health, Black people suffer disproportionately. So they either are diagnosed at higher rates, experience higher morbidity or disease related complications, and higher deaths related to various diseases also. And that's on almost every indicator of health. We see COVID is new, and we see the same trend with Black people. And there are a host of reasons that are associated with that. And one of them is, like you mentioned, experiencing disproportionate amounts of stress. Now, I definitely don't want to say that this is the main reason. There are a host of larger social factors, larger instances where the government has failed us time and time again, that if we address those issues first, things like poverty, things like stable housing, things like safe communities, things like better schools for our kids, other educational opportunities, addressing more of the larger social determinants of health would certainly have a greater impact than addressing stress. But stress is what you asked me about, so that's what I'm gonna talk about. Stay on track. So with regard to stress and Black folks experiencing greater burden of stress and also greater reactivity to stress related phenomena. So in particular, you mentioned allostatic load. You had the definition right on point. It's this cumulative wear and tear on the body. So what does that mean? Most of us have heard of the fight or flight response, right? So essentially, this happens when you're experiencing a stressor, your body goes into some sort of response. So if you think about when you have an argument with somebody and you start feeling like some fire in your chest, or, people say, oh, my blood was boiling, it's probably your blood pressure going up, right? You're having a stress response. And so essentially the idea behind that fight or flight response is you having a stress response that will either mobilize your body to some sort of action. Back in the day when we were facing animal predators, it was to either fight the animal predator or run from it, right? And scientists are saying that we still have that adaptive stress response in our bodies. So we're still getting increased blood pressure, increased circulation of various hormones in our body to help us fight or run. And we're not necessarily using that energy, right, to fight anyone or run. Some of us.
Yeah.
A lot of us are, trying to figure out, how do we manage this stress response when we're not fighting someone, we're not running. This can be when you're getting pulled over by the police. This can be when you're getting racially profiled in a grocery store or a department store, or walking down the street, or dancing in the street, or going for a walk and asking somebody to put their dog on a leash, et cetera, scrolling your social media timeline and seeing Black people murdered in cold blood. The list is literally long, long, long. I don't have to go through all the examples, but these are the instances in which your body is going into that fight or flight mode. And when it happens frequently, consistently, day after day, over time, that response that was created to help you actually starts to harm your body's systems, right? And so that's when you see like a decreased or weakened immune response and increased susceptibility to other conditions, other chronic conditions specifically. And I'd say even now, viral conditions as well becomes more susceptible to those. Yeah.
So yeah, I was just trying to show the correlation, or even just talk about it as far as like chronic stress and then chronic conditions or chronic diseases. And like you said, although stress is not the leading factor, all those social determinants of health or the day-to-day experiences that we experience, even just being as Black people, and that level of stress that associated with all those elements do, like you said, weaken our immune system, makes us more susceptible to so many other ailments. And like you said, we're on every health indicator, right? And that is also not, I don't want to say scared, because it's almost like a level of like normalized, like a normalization, like clinicians, scientists know, okay, African Americans are going to be leading in every chart. So, and then we now, as a general public, understand that, yes, we have this, African American has this type of chronic conditions, or we're known to have diabetes or hypertension. So it's almost like, I don't say a numb factor, but it's not like, it's like the so what is not as powerful, because the so what is not really leading to true changed, either changed behaviors or changes in government or changes in medicine or changes in health providers and how they assess us when it comes to different health needs. And so I think that is what's a bit frustrating about that understanding, is that it's so intertwined, it's so complex, but at the same time, it's now almost become like an acceptable norm, which is not okay.
I would have to 110% agree that it's definitely the case where you see a lot of assumptions being made about Black people's health, sexual health, cardiovascular health, metabolic health. And yeah, assumptions are harmful, especially when they're made on behalf of providers, but even when they're made on behalf of patients as well, because sometimes I think there can be this sort of learned helplessness of like, okay, well, this is what everybody in my family has had, and I was bound to get it at some point. So, there wasn't really much I could do about it from the beginning. But that's certainly not the case. There are, the statistics are certainly troubling with regard to Black people's health, but it's not all Black people that have hypertension or cardiovascular disease or any other condition. We may be leading, right? We may be the majority, but it's not all of us. And so one area where I feel like research is definitely not really delved into much and could benefit from further exploration is looking, instead of focusing all of our attention on Black folks who do have health problems, let's focus on also the folks who don't, and see what is it about their circumstances, their life conditions, their health behaviors their social networks that are different, that are allowing them to, create a healthy, longer life.
I like that. I like that.
It's like a more positive psychology approach, more community psych oriented approach.
Definitely. Question, since you brought that up, my immediate question is, why do you think data is pushed in that manner to show the problem or over magnify that versus the healthy positive?
I personally, I don't know the 100% answer to the why, but I personally think it's a cultural thing. Sort of in the United States, we're problem focused, we're reactionary. So even if you think about how we've approached COVID, we were not prepared. We had a very reactionary approach. And even if you just flip on the news right now, you'll see all the news is all problem focused. Okay, these are all the states that have the rising cases, and these are all the problems that their rising cases are having. These are all the hospitals with maxed out ICU beds, and these are all the providers that have passed. But there is much less attention placed on, okay, these are the states that are doing well. These are the providers who've been working on the front lines for, 4 months and have amazing health. We're much more problem focused and problem oriented. And even when we write up our publications based on our research study findings, when we're applying for grants, the expectation is for you to present things in a problem focused nature. So I think culturally, like the Western approach to science and to health is a problem focused one.
Okay.
And that's not the case everywhere, I will say that.
Okay. Well, I guess it's just fair to know that that is what's happening. So I think maybe, I don't want to say the ask, or maybe something that we could do as consumers of media, of consumers of data, is to also question, right? Or say, hey, well, if this is, if 40% have this and maybe the 60% don't, and maybe just kind of naturally questioning that and trying to do some additional self-study. I'm big on self-study because no one is going to show you everything or teach you everything. You have to take it upon yourself to go that extra mile, ask internal questions and seek information. So you can get maybe a well-rounded answer.
Yeah, absolutely.
So I got a whole lot of questions for you. Well, not too many.
Ready, pull them out.
Okay, so we alluded to this a little bit, but how would you describe implicit racial and ethnic bias among healthcare professionals and its influence on healthcare outcomes?
That's a great question. I remember a few years ago, I was writing a paper on addressing health disparities among Black women in the United States. Mm-hmm. And I remember during the process for having that publication reviewed, mm-hmm. one of the reviewers, we had a section in the paper about how important it was to address issues related to healthcare access, right? Black people, Black women in particular, need more access to healthcare. And we sort of talked about creative ways, innovative ways to ensure that that happened. And one of the reviewers wrote and asked, do you have any data or studies that support that when Black people or Black women in particular get greater access to healthcare, that they actually have better health outcomes? And so I start, searching the scientific literature to see, are there any studies that support that notion? And I found the opposite. I found that when Black people would go into hospitals for life-saving treatment for cardiovascular disease, for example, they were often turned away, misdiagnosed, or not giving life-saving treatment. And this is in comparison to their white counterparts. I found, completely just shocking statistics on Black maternal health and Black women's experiences in maternal health care settings. And similarly being turned away, oh, you're not ready for delivery yet, go home, or not attending to various questions or complaints or concerns that Black women have that end up becoming life-threatening emergencies for them. And so saying all of that to say there are some very problematic ways that bias shows up in healthcare settings. Even in sort of scenarios, I saw a research study done before. So in scenarios where it's not real life, there was a research study done where the scientists gave the medical students like vignettes, so stories of Black people, white people, people of other racial and ethnic backgrounds. They say, okay, the person comes to the hospital, these are their symptoms, what would you do? And the medical students were less likely to refer Black people in their stories for life-saving treatment or interventions, even when they clearly needed them or demonstrated symptoms similar to that of their white counterparts. So there are obviously some deeply ingrained issues related to racism and bias in medical education and in medical practice that need to be addressed, that ultimately have an influence on the quality of healthcare that Black folks are getting in this country, and naturally the outcomes that they experience associated with that care.
Wow, I think that's big when you said, because I actually did some research and saw the same thing, where there was a test done on actual providers themselves, right? And in which they're also perpetuating their own personal bias. And I think what's really hard is if you've had some independent personal experiences with a certain group, that you may take that bias onto the workplace. You know how sometimes they always say, like, leave your work life at home and put your, your work hat on. But I don't believe that that's effectively done when it comes to health, and especially when people's lives are at stake. I think the level of care or interest or empathy when it comes to African Americans is really diminished, to be honest. And it's almost like you question if healthcare professionals really see our humanness, right? See our souls, see us outside of the context of our skin color. And not trying to make this like just a skin-oriented topic point, but I think it's really important to illustrate how personal experiences really do come back into the workplace. And maybe that notion like, hey, leave work at home, it never really stays home. It goes with you everywhere you go. But now when it comes to medical practice or medical practitioners, and those practitioners are mentors, they're educators, and how they're perpetuating this bias, and also suppressing a group from true health outcomes. It wasn't just Caucasians. This was across the board with various ethnic providers, right? Feeling the same thing about one particular subject group, whether it's African Americans, Hispanics, Native Americans, or what have you. It was just a less consideration, I guess. So that I wasn't really too pleased to see that. And I haven't done extensive research, but the publication that was out, they did extensive research to publish that information. As an educator, though, I think that was one of my questions in here, but I'm gonna ask it now. How do you as an educator try to combat that? That the bias that exists in the classrooms, or that you may see working with different peers at different projects, or how do you try to either address that?
Yeah, that's a great question. So I primarily have taught courses in psychology. I just recently transitioned to a school of public health and have not begun teaching in public health just yet. But in my experience teaching in psychology, I think it makes for a much easier entry point. Not to say that because it's easier, that means it should be done or not done or anything. But just to say that the conversation is definitely more fluid in that regard. And I think students expect that it will be part of the conversation. because the thought of bias is a psychological construct, and something that happens in the mind, right? So I teach a course called Health Psychology, and we definitely talk about patient-provider interactions. And I do end up, I think, with a lot of students who want to go on to medical school, or other practice in other health-related fields. So I don't know if the course is life-changing in any regard, but I would say that students definitely learn about health disparities. They learn about the factors that are contributing to health disparities. They learn about what they can do as individuals and what providers can do in systems, and what our governments can also do to help reduce and relieve health disparities. And one of the things that I do to sort of encourage application of that knowledge is I have students design an intervention, and I purposefully have them make it like a multi-level intervention now, so that they can figure out and really grasp grasp the fact that it's not just the individual that's the problem. So I remember a couple of months ago, I think it was I can't remember exactly who it was. My brain is giving up on me right now. But someone in the government was telling Black folks and Latinos to essentially to do better in their personal health behaviors with regard to, oh my goodness, I can't even remember what it was now, but I just remember, like, do it for Big Mama and do it for your abuelo. And it was like, as if to say, I'm gonna have to Google it before we get off, but it was as if to say these issues are solely a function of behavior, and they're not. Yeah. A lot of conditions can be prevented, don't get me wrong. Heart disease, stroke, diabetes, often cancer as well. These things can be prevented by and large through diet, exercise, and not smoking, right? Managing stress, sleeping. But that's not enough to address these issues for everyone. There's a really great PBS special. I think folks could Google it, and it's free. It's called Unnatural Causes. So if you Google Unnatural Causes PBS, you should be able to access this. Really, really great informational videos and discussion questions and guides. But they essentially talk about how addressing individual behavior is important, but not enough. And even for Black people, one of the examples they gave was the maternal health crisis in this country with regard to Black women. And they talked about, Black women who are highly educated. We're talking advanced degrees, Juris Doctors. These are lawyers, PhDs, professors, scientists, MDs, doctors, even individuals with the highest degree of education. So they say education is supposed to be one of the, primary predictors of health, right? So we would expect that Black women with all of these advanced degrees would have better health than other women with advanced degrees. But we see this phenomenon among Black women, and I'd say Black people in general, called diminishing returns, right? So it's like, for us, we don't get the same bang for our buck in terms of the impact of our education or income or community on health, right? For us, because there are all these other factors that are still tearing away at our health, like bias, like systematic racism, for example. So in the instance of maternal health with Black women who have these advanced degrees, compared to other women, it was like Black women with advanced degrees have the same birth outcomes of white women with high school diplomas. So it's like you can see the disparity in that literal example of the diminishing return. It doesn't matter how educated you are as a Black person, doesn't matter how much income Serena Williams you make, you can still have these very real issues in healthcare systems that are a function of quality of care, ill-trained providers, systems that were not designed for our particular needs or benefits. And not to say throw the whole system away, but I think one of the best things that we can do as Black people is try to get with providers who either are Black, and that doesn't mean that they will be better necessarily than white providers, but they got a little bit more likelihood. Providers who either are Black or who have worked extensively with Black people or other people of color and have that sort of training and background. Because when you get people who haven't worked with Black people often or haven't had that exposure or that training, they often don't know how to handle Black issues and often haven't addressed bias in their practice.
Yeah. Yeah.
And I want to make sure that people know anything that I'm saying, this isn't the sort of golden standard for everyone. These are things that happen. It's not necessarily, if I say this is happening, it's happening with everyone.
Right. No, and I think it's important. So I'm a mother. My son is 11, but I was low income when I was a sophomore in college, but that's besides the point. But I remember leaning a lot on my doctors, to provide me with counsel and information and to really hold my hand through this process. And I do remember vividly that the doctor that I would always see and built a relationship with was not the doctor that delivered my child. So, the doctors, go on rounds. So not necessarily that all the doctors are there and that you built a relationship with. You might have a doctor from that same practice, or maybe it's some other doctors that are from a different practice that just happen to be there and the timing aligned where you're seeing someone else. So I think that is a little bit disheartening, because if you do seek and find someone that you've built a relationship with and that understand you, that understand your body, that you trust, and then it's time for delivery and you have someone else that you don't know, and you're stuck in a rock and a hard place because it's a state of emergency now, right? And so that's where that institutionalized racism has to really be dismantled, because the care of all participants or all parties matter, right? Matter. And if you're if you're the one in charge and treating and caring for them, then you need to care for them exclusively with the best care, the best judgment, the best counsel, with their lives at hand, with their unborn in hand, and maternal health it's so scary, because you question motherhood, you question, do I want to have a baby? Should I even plan to have it? And alternative methods of planning to have a child, whether it's through midwives or other alternative methods of delivery. But at the same time, you just want to know that if in an event that I have to go to the hospital, will I be in good hands? Right. Will I be safe? And then also there's a question of self-advocacy. A lot of people don't know how to properly advocate for themselves with a doctor. When you're one-on-one with a doctor, you may not necessarily know how to speak up or advocate for yourself. And I'll have to figure that out another day. Speak up and advocate for yourself. And I don't know if enough coaching is appropriate to support that. What do you think?
I think, honestly, let me just close my blinds so I can stop sweating in my blazer from the sun setting on me in this exact moment. But I think with regard to maternal health especially, I think it's so important. And I would say definitely in the case of maternal health, but in other aspects of health as well, it's so important to have an advocate with you. Ideally, you would be able to advocate for yourself, but if you literally feel like, as one of my sorority sisters says, every bone is breaking in my body and they're all splitting through my skin. That's how she described her labor. If you feel like that in that moment, you're more than likely not going to be able to advocate for yourself. Some women may be, but others may just be in a state where they're trying to manage their pain, manage this process. So ideally, talking with someone before you get there, weeks before your birth, months before your birth, or other healthcare experiences, this is the kind of experience that I want to have. These are my priorities. This is what I don't want. Under, any circumstances, don't let them do this to me. Or make sure they do this for me, like advocate for me until they do it. Don't let them tell us no. Have that person in place and make sure it's a person that will stick to their guns and advocate for you no matter what.
Yeah, and I think that's what they call like sometimes like a durable medical appointee or representative and so on. But I think, that's the reason why this platform is so important, is because, sometimes we don't really not only prioritize, but realize that health is a part of our everyday life, and that has to be a subject matter in which we're experts in, or experts in navigation and knowing how to access the information appropriately. One thing that I have seen is that a lot of people don't feel the need to seek second opinions when it comes to their doctors. Like once they find a primary care, they're with their primary care for life, and a lot of people don't really find the interest, or it's maybe too much of a hassle, or it's cumbersome, or you don't feel like doing the work to find an adequate healthcare provider, especially when you have multiple chronic conditions that you're battling with. So now you're seeing you have your primary care, then you have all these lines of specialists, and it's just all too much, and you just don't feel like it. That's also a decision as well that can also either aid to the betterment of your health or not, What do you think about that?
No, I think that's a great point. And I also think that it highlights that it's generally not easy to navigate the healthcare system, especially when people have concerns about, well, I don't have insurance. So I don't want to go to a place where, I'm going to get sent home with a $25,000 bill and my credit's going to get jacked up, or whatever the case may be. Or I don't have the greatest insurance and that poses similar concerns. Or I really want to meet with X type of provider, someone who, is Black, or someone who is a woman, or someone who has worked with or is LGBTQ friendly. So all of those things are concerns that are floating around in people's minds. And then just the process of finding a provider is not easy. You call, there are long wait times on the phones. You go in, there are long wait times. You call, leave messages, people don't call you back. It's just not, it's a system that has a lot of bottlenecks. And oftentimes people make an attempt, and if that attempt isn't met immediately with sort of a fluid transition, if it's met with any sort of challenges or difficulties, it's like, okay, I tried and I don't have time to keep trying, or I don't have a desire to keep trying, right. Which is completely understandable given all of the instances in which your attempt can result in nothing or starting you back at square one.
Yep. And when you talk about health, you talk about insurance. It's just so big, and I don't want to get into all of it. But even though it is very complex and very nuanced, that should not stop you from doing your part in choosing what's right for you when it comes to providers who are competent, like you said, that have experience with various type of ethnic group, that pertain to you or to your family structure. You want to make sure you're properly taken care of at all times. And so although it may be taxing, it's important to do your due diligence and research. And also, you can always look up your doctor as well and look up their research that is accessible. As far as they're board certified, and a lot of locations may have like a bio about that practitioner. But more importantly, when you're meeting with them, ask them questions about them. You have the right to interview them as well, and determine the best fit. And I think even in those little instances, whether it's an initial visit or preventative care visit, just really assessing, are they really listening to you? I just think just be mindful, was I heard today? Did that Do they really understand me? And if you don't feel heard or don't feel seen, then that's also a reason for probable cause to maybe do some additional research or ask some additional questions or have ongoing conversations and not just settle in that and be okay with that.
Absolutely. I think that's an amazing point. A lot of times we just trust that, okay, the person is a doctor, they must know what they're doing. But we don't do our research. There's some sites that people are able to post their experiences with different providers. So if you Google a certain provider's name, sometimes you'll see like damaging reviews that'll come up about that person that may make you think twice about having them as your provider. So using that information and then your own sort of intuition and gut feeling when you're talking to them as well, I think those are amazing tactics and strategies to engage in to determine if a provider is right for you.
Definitely, definitely. So when we haven't talked much about HIV and someone being HIV positive and in this time period that we're living in with COVID-19. I know when this first started, some people try to make some comparisons and people found that problematic, trying to make such a comparison. But how would you either give some recommendations on anyone who is HIV positive and navigating this space and this time period and how to best protect themselves? What would you recommend?
Yeah, I think individuals who are living with HIV definitely need to be more cautious in this time in terms of the people that they're surrounding themselves with, the places that they're going to, behaviors that they're engaging in with other people, and not just related to sex. Like literally right now, we're talking about a condition that now scientists are saying is airborne, that can be spread from people breathing, talking, singing, laughing. So if you're an individual that has a compromised immune system, and this isn't just individuals who are HIV or who are living with HIV, it's individuals who are living with Crohn's disease. It's individuals who are living with cancer or previously had cancer, individuals living with diabetes or cardiovascular disease, anyone that has a chronic condition where their immune system is compromised needs to be extra careful. Our elders also need to be extra careful as well. And we need to be extra careful around those individuals too. So if we're not an individual that's living with a chronic disease or we're not older, in addition to being careful ourselves, we also need to make sure we're not, especially if we've been around people and we don't know their COVID status, we're not engaging with people who have a compromised immune system or they're in any other category for higher risk, right? Because it could be deadly to them. I remember talking, this was early March. I was flying from Baltimore back to Boston, and I was on an airplane or next to a gentleman who had on a mask. We were the only two people on the plane that had on a mask. It was a completely full flight. And we were both getting the evil stares like, why are y'all wearing a mask? You're completely overreacting. And I remember him asking, he was also a scientist, a professor. And so he was like, I just want to shout you out, sis, for wearing this mask, and so we both started talking about why we decided to wear masks at a time when really almost no one was. And I learned from him that he was a cancer survivor. And he said, my mother did not want me to get on this plane. And when I told her I was going to do it anyway, she said, please, 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 please wear your mask. Like, we don't need you getting sick again. And so he said, I'm making this trip. This is going to be my last trip, but wherever I go, I will have on a mask because I don't want to get anybody else's germs. Right. And that's the reality of it. I remember another brief story. I was in DC not long ago, and was having a socially distant dinner with a friend. We both had on masks. And there was a gentleman walking by us who was not wearing a mask. And so we socially distant had a conversation with him from like across the pier, like, bro, why are you out here without a mask on?
Yeah.
And he was like, I trust my ancestors and I take care of myself. I eat good. I work out every day. I drink this, I eat that. I'm not really concerned about my health. Mm-hmm. And so he said, but so why are y'all wearing a mask? And my friend talked about, a mask as a protective measure for herself. And I said, in addition to everything she just said, I'm also wearing a mask because I don't know if the person that I'm walking by has a condition that might make COVID deadly for them. So if I'm carrying COVID and I'm asymptomatic and I'm he and ha-ha down the, harbor in DC, and my germs float in the air across to them and they inhale them, they ultimately contract COVID from me, a person that's asymptomatic, it might not be a asymptomatic experience for them. It might be them in a hospital on a ventilator. And I wouldn't want that. I wouldn't want me to be the cause of somebody else having weeks of sickness, even if they don't make it to the hospital, weeks of sickness, just that, or God forbid, them ending up in a hospital or losing their life when I could have just worn a mask.
Yeah. And I think I think once again, it's like we have to be caring of our neighbors, like loving ourselves. Let's say it in the Bible, like love yourself as you love your neighbor. So one of the things is a lot of people, you're seeing how people care for themselves, because then they'll show you how they're willing to care for somebody else, right? And so that he's saying that he's really caring for himself, his body, he's doing what he needs to do. But then there's also this dismissal of, hey, nothing's going to happen to me. This COVID thing is out there, but it's not going to catch me, which is fine. But then, like you said, in one token, the other token is you're compromising other people that you don't know. But if we all had that level of care of our brothers and sisters and the humanity care of each other, then we will do the right thing, even if we feel that it's not necessary or it's an inconvenience or it's uncomfortable, or, I don't really like to wear the mask as much. I'm like, because you can't see my smile. And I'm like, and it's like my makeup, I'm sweating. I'm like, why did I do my face? I'm sweating my makeup off. And I got a line right here. So I'm just like, you're trying to make a move, but you can't really make one all the way, fresh. So it does have its challenges, but again, we have to understand that we're in a unique time. This is a historic time, but also a time in which we don't know if we're going to make it to 2020 or 2021, and so we have to just do the best we can to wake up tomorrow, and be here for our loved ones and not do anything that gets in the way of that. And so,
you hit the nail on the head. And one of the instances where I do appreciate the parallels with COVID and HIV is where you just made those comparisons, right? Like a mask is a protective barrier from you transmitting a virus to someone else. And even you may be unknowingly transmitting it if you don't have on the mask.
Yeah.
The same thing with condoms,
right?
Yeah. A condom, a barrier to prevent you transmitting something to someone else if you don't know your status, right? And there are a lot of people out here, 1 in 5, that don't know their HIV status. They haven't been tested ever, or they haven't been tested since the last time they were exposed, or not necessarily exposed, but exposed to a risk factor for HIV, I should say.
Yeah.
And if you're having sex unprotected, it could be you, if you don't know your status, passing HIV to another person. Or if you're having sex unprotected with someone, you know your status, but they don't know theirs, right? It could be the other person. What eliminates the confusion and sort of risk for everyone? A barrier.
Exactly.
A mask.
Yeah.
So... and like you mentioned, there are all these inconveniences with the mask. Like, people can't see my smile. It's uncomfortable. I'm sweating. It's hot in here. I can't breathe. Right? Same thing, or very similar things for condoms. They're uncomfortable. I can't feel it all the way. It's not as good. whatever the case may be. But the reality is, if you don't know your status or that person doesn't know theirs, if y'all aren't in a mutually monogamous situation, or if there is a person that's in the relationship that's HIV positive and they're not virally suppressed, the condom mask is going to be your best bet.
Yeah.
And I do want to throw a plug in for the U=U campaign that at least I know Baltimore had out. I'm not sure if it's national just yet, but it's undetectable equals untransmittable. So in the world of HIV, essentially that means for individuals who have a suppressed viral load, one that is undetectable, that means that they cannot transmit the virus to someone else. Like there is a 0.01% chance essentially that they would be able to transmit the virus to someone else. So it is possible to have sex with someone that's HIV positive if they are virally suppressed. So I just hope that offers some peace for folks out there. I hope that reduces some of the stigma and thinking about being in relationship with individuals who are living with HIV. It's possible for them to have extremely healthy sex lives. It's possible for, if you want to date someone that is living with HIV, for you to have an extremely healthy sex life with that person as well.
Right. Thank you for sharing that. Yeah, if you needed to receive it, embrace that,
I just hate when I hear like, oh, I would never date someone who has HIV or who's living with HIV. And it's like, it's a condition. Like if all the reasons not to date someone, that's the one that you're going to pick, a condition that can be managed, that can ultimately not impact you if it's managed, like that. There are a lot of reasons not to date folks. I personally don't think someone's health or them having a chronic condition should be one of them, especially when it's a condition that can be managed and not have an impact on you as their partner.
And one thing I like how you said is someone having a chronic condition, because once you say that, it destigmatizes the negative context of what HIV has always been pushed as, which is this, nasty, distasteful, disease that's sexually transmitted. And it's all this, I don't want to even push that agenda or reverberate the bias or stereotypes, but whatever negative association that has had, and it has had on the minds of people, and also has had in academia, right? As they're sharing this information and teaching, students, is also saying that, hey, this is a chronic condition, right? So sometimes you don't know how you got cancer, right? Or how you received this arthritis, or how you got a stroke, or you don't know what was that thing or what was that moment, you know what I mean? Where your life turned or where your life changed. And so it's really about not only having empathy, but also, I'm going to use that word, respect for humanity, and that they still have, those who are HIV positive are still vibrant individuals that still have a life, that still have life to give and deserve of love. It was this movie called 90 Days. Did you see the 90 Days?
I didn't.
Oh man, you gotta go look that up.
Tell me about it.
90 Days. Oh man. So it was a beautiful woman. Oh, she was so cute. And she was positive, and she fell in love with this man, and they did not have sex, I think, for 90 days. Don't get me quoting this wrong, y'all. Forgive me if it's wrong, but it's really quick. It's like 15-minute movie, but it was done really, really well. But whatever the case is, the guy proposed to her and was like, he told his mama he found the one. He chose to be with her. But once she said that she was HIV positive, it was like, it crushed his world. The relationship was over. It was done. She was devastated. And it just ended. There was no there was nothing else after that. They didn't show if they made up or what happened with his life. Oh. But I think it really just highlighted what you said, which was you can still have a very vibrant life, as a professional, as a contributor to the world, in relationships. And you remember how they used to say, you can't tell who's HIV positive, you cannot diagnose someone off of just seeing them, right? And so she looked aesthetically pleasing, you know, and had her thing going on. And so, but I think it took the wind out of him. I don't know if it's because of when she told him, but at the same time, she was trying to, you know, get the courage to tell. So sometimes when you disclose, you know, you're treated differently. So I think it was really trying to probe our mindset to think like, hey, would you lose it all, or would you risk the possibility of being with their one because they're HIV positive? Like, would you just walk away? I think it was really just trying to show a new face and a new light that, hey, not just only men, maybe HIV positive, women too, right? Mm-hmm. And also showing a different light, like, hey, you don't have to look one way. This is a beautiful person that's professional, that has things going on. But at the end of the day, what would be your decision in 90 days? You know, how would you handle somebody? And I think that's just, everyone has a right to decide what they'll do when that time comes. But I definitely am a big proponent for disclosure. You know, we have a due diligence and responsibility to disclose. And even when it comes to COVID, if we were positive for COVID, you know, stating that, right? When you're being asked, hey, you know, were you tested positive for COVID? Say yes, quarantine for 14 days and do the right thing and disclose that information, because that's the worst violation, is not giving someone the right to choose. And that is like the worst of it all. Yeah.
Yeah, I agree with you. Not giving someone the right to choose is certainly a violation of that person's rights, their sort of freedoms. And I think the point that you made earlier, sort of your description of that story, is really interesting because it makes me think of the ways in which people are discouraged from disclosure. So if I tell someone that I think maybe after 90 days, maybe I think they love me, or at the very least care deeply for me, or care about me in some way, and they blow up and cut me off or ghost me, that would not encourage me, right, to tell another person, or maybe not encourage me to date for a while, or if ever. And I know some people who are living with HIV who feel that way. Like, no, I tried to tell someone before and this is what happened. I'm not telling anybody else, or I'm just not going to date, or whatever the case may be. I do 110% believe everybody deserves to know. And I love the way that people are having conversations around COVID now. Like, hey, have you been tested? Like, hey, I want to kick it. Have you been tested? I got tested. These are my results. And it's like, oh my goodness. Like, can we have this same conversation where we recognize, oh, people get COVID. It's life. You know what I'm saying? Like you said, they may not know exactly how they got it or when or what they were doing, but they got it. They went and got tested. They're doing what they need to do to manage it. And no one, I don't want to say no one, it's not as heavily stigmatized, right? As something like HIV, where it's like people aren't even having the conversation before they have sex about whether or not they got tested for anything, let alone HIV. Is like, there are a lot of other conditions out there that can be harmful to your sexual and reproductive health or overall health that can be contracted through sex. So I hope that the wave of conversation that has been happening with COVID around testing and statuses has some sort of a spillover effect to sexual health, where people can have these same very low pressure, low intensity conversation around, have you gotten tested? What's your status? Oh, okay, that's what's up. Or what are you doing to manage it? Or etc.
Yeah, but I think what breaks that barrier, or that you know, because I think when it comes to, because I used to do a lot of like sexual health talks, but also became really redundant, right? And it's just like, now with health coming into the forefront and people understanding that their lives are compromised, right, by their health. So if you get COVID, your life may be compromised, you know, your respiratory system may be compromised, like so many different things. Now you're like, whoa, okay, I have to, you know, like my life matters, you know, my family matters. So now you are having a certain level or stronger self-value and self-worth for your life, right? Not just only for pleasure, but for your overall life. And so this COVID has pushed people to talk about testing, you know, and get uncomfortable about health and talk about health in a real honest and real way, you know, talk about chronic conditions and underlying chronic conditions in a real honest way, and about our seniors. And so I think that's why it's so important to push health and continue to talk about it in an open and honest forum, on an ongoing forum, so it'd be more normalized, right? To have these conversations. So therefore testing and testings and statuses is not so taboo, because even times when you do get tested in secret, right? Or you get tested and you just kind of like, okay, this is for me to know, and that's all. But there's not an openness, right, in testing and in sharing of information. And so I think that there will be a change, and I think maybe a sustainable, lasting change, because it's altered our life so dramatically on a global level, right? So you can talk to someone about COVID, and, you know, my family's from Kenya, and they know what COVID is, you know, and here they know what COVID is. And although we may have different experiences, a certain level of understanding of that. And yeah. And the pain that's been associated with COVID, with the deaths, and you know, the pain with our first responders and different things like that. I just think it's a certain level of sensitivity. And so I think it'll be the job of an organization like AIDS United, or and all these other big organizations, to really push a new narrative or a new programming or messaging around HIV/AIDS, and kind of change the old way of messaging to really hit the hearts of the people in a real honest way. So.
Yeah, I agree. And I think that's a really great point. Innovating, we see like a lot of the major companies who have been very successful have mastered the art of continuous evolution and innovation. And I definitely think that's something we're behind the curve on in the field of health and health communication. I've seen some creative stuff, but I definitely think we have ample opportunity to innovate, especially in our communication around HIV. So certainly that's an opportunity.
Definitely. And then also, I'm going to conclude very soon, but also when it comes to like funding for marketing purposes, you know, so, you know, with me having the Pulse Project, it's around sexual health, mental health, for women of color, or for African-American women to be in particular. But I'm not a clinician. I'm not into clinical anything, right? I don't mind doing a little testing here, but I'm not interested in, I'm interested in more advocacy and promotion and dialogue and conversation and connectivity and engagement. And there hasn't been adequate funding. There's only funding a lot for like research, you know, and funding for treatment and HIV positive people. And I'm like I just want to reach people who want to hear the message, especially, you know, women of color. So yeah, there definitely needs to be a lot more funds around marketing and prevention and messaging. Yeah.
I would agree 110%. And I think you're speaking to, in part, the importance of implementation. So we have a lot of successful interventions in HIV for prevention and treatment. And most of the grant money goes to the actual development or testing of those interventions, and not necessarily the sort of nuanced pieces of the rollout related to those interventions, like health communication and marketing. 110% agree with you.
Yes. So I have my closing question for you.
Okay.
And this question is, all right, let me pull it up now. Let's see. Okay, so the history of Western exploitation of Africa and unethical drug trials in the past have caused great resistance towards vaccines. Okay, vaccine trials in Africa are such a sensitive topic right now, and many people are speaking up about it. In particular, on July 4th, Minister Louis Farrakhan warns Black people, do not take their medications. I say to you, my brothers and sisters in Africa, if they come up to you with the vaccine, be very careful. So I just want to know your thoughts, since you've worked and done some work in South Africa and other places. Just what are your thoughts around, you know, the apprehension and resistance when it comes to vaccines?
I think it's completely understandable and justified. When we think about a lot of the medical advances that have happened in this country and other countries, there were a lot of experiments and clinical trials, that were done in Africa, that were done in the Black community first to perfect, for example, surgical procedures. A lot of folks, I have a book over there I just took out to sort of flip through and reread a bit, Medical Apartheid. Um, and in that book, the author talks about some of these experiments that have been done on Black folks here in the United States, um, where they're completely unethical experiments, completely unethical surgeries. And the physicians that are performing these surgeries are heralded as the father of this, for example, the father of gynecology, or um, the leading, physician in this. And these folks did very awful things to humans. Um, and it's study after study after study, right? I mean, it's an atrocity. Even in this country, a lot of the medical schools, um, up and down the East Coast and the South, et cetera, were robbing graves of Black folks to get cadavers for medical school classes. And yeah, it's like black bodies are not safe in life or after. You know what I'm saying? Like, when do we ever have a moment of safety, um, in this country or in other countries, and even in Africa? Like you mentioned, there are tons of vaccine trials that are going on in Africa. For years, they've been doing it for all different types of conditions, and especially for HIV. And as an HIV researcher, I think it definitely, and a Black person, um, it makes me feel some kind of way. Like, why are they doing all of this in Africa? Why aren't they doing some of these studies here? Or why aren't they doing all of them here if it's, US money that's funding it? Or why aren't they splitting it? Or why is it the majority of these studies are happening in Africa? And the justification that people will use is, oh, well, that's where HIV is most prevalent. But I honestly think this is where people are more vulnerable, less likely to advocate for themselves, less likely to ask questions, more likely to want to take that research payment that comes with participating in a clinical trial. And I just think it's a sad but unfortunate, sad and unfortunate, uh, I'm trying to, like, violation of human rights, really, to be doing these kinds of things in low and middle income countries where we see the burden of everything is greater, right? Especially the burden of disease. And so, with regard to vaccine development, there definitely needs to be a more equitable distribution globally of where we're conducting these trials and with whom we're conducting them with, so that it's not like we're doing this medical experimentation among one particular demographic group. And it also happens with people who are poor, people who are experiencing poverty. Those individuals get targeted as well for a lot of these experimental trials.
Yeah, yeah. And like you said, in one, they accept that to meet the social determinants of health, right? And what they call Maslow hierarchy of needs, just the basic needs of life, So you're like, okay, I'll do this for just to feed my family or keep the lights on. And so, it's almost like the preying on the I don't say their innocence, but preying on their lack. Vulnerability, their
Yeah.
vulnerability. And so it's the unfortunate truth, but that's happening. I've even seen t-shirts online that says Africa is not a testing lab, and those statement t-shirts, and it hit me. I was like, whew, okay, and being first generation American, my family's from Kenya, I was just like, man, knowledge is power for real. At least you get the power to choose or make a decision, at least think, right? Think, think and advocate. So, my dear, I believe that concludes the conversation. I feel like I had something else to ask you, but I don't know. I know I've exceeded. I've exceeded my time frame, but I don't know what else. I think that's pretty much, that's it. I'm gonna call this a job well done. I'm gonna call this a job well done. It was such a pleasure to speak with you this evening. True honor. True honor. Want to see. Oh, I remember what it was. I remember what it was. And I asked. I would have asked it. One last thing. So I started something. So my mother, both my parents actually died from chronic conditions. My father had HIV, later turned into AIDS, and he passed on. He probably had some other illnesses that I'm unaware of. I have a loved one that's living with HIV in Kenya. I had an uncle who passed with AIDS, maybe dealt with some other issues as well. Because when your immune system is weak and other conditions come on. And also my mother passed on with she has so many chronic conditions. But so I created Discover You Health really in honor of my mother, to support people, not only support the geriatric community, right, with home care services, but also to really support adults with chronic conditions and create more like a wraparound services when it comes to like medication with a pharmacist, nutrition with a dietitian, like if you need physical therapy or physical therapy or a personal trainer, because I know those are like the key variables, right, to help prevent some of those chronic conditions, but also more of like, the nurse, having our nurse on board, our caregivers, if someone needs more like direct one-on-one support with anything. But I created this wraparound service to help, one, educate and create more of that one-on-one relationship, right? And that consultative support, not only to provide like, hey, this is your to-do list, this is what you should do, but hey, this is what you should do, this is why. I'm available to answer any of your questions. I'm accessible. I am personable. At the same time, I'm able to hold your hand through the navigation of implementation, right? And I think that's where healthcare kind of drops the ball, is in the implementation process and any barriers to that, or any hiccups that occurred along the way. There's no real support, right, or encouragement, or along the way to get you to that health outcome, that desired health outcome. So I don't know what your ideas around that, or ways to really promote solutions, or how people can invest in their health in a real practical way, and really emphasizing the importance that investment in your health is not just seeing your doctor or seeing your specialist, but what are the other outside things you could do to really take a proactive investment in your health.
Yeah, I first want to say thank you for using your life experiences to sort of fuel your passion for this work and starting these initiatives. We need this in our communities, and so I thank you for being one of the individuals who's championing the effort. Thank you. And to answer your question, I saw the CDC article a few years ago, and they talk about 3 health behaviors that you can do that can prevent 80% of heart disease and stroke, 80% of diabetes, and 40% of cancer cases. Diet, exercise, stop smoking. Healthy diet, increase your exercise, stop smoking. There are a few other things, of course, I mentioned earlier, like managing your stress, getting adequate amounts of sleep. Doing all of those things can substantially reduce risk, and even in some instances reverse cases of disease like diabetes or heart disease. So a lot of times people think, oh, if I have heart disease, it's with me for the rest of my life. If I have diabetes, it's with me for the rest of my life. Cancer, same thing. But that's not the case. There have been proven research studies that show things like diet and exercise, when done consistently over time, and you can't be cheating with your sweet potato pie, fried chicken every other weekend. Like, you got to be consistent with this thing. It really can transform your body from the inside out and can actually result in reversal of disease.
Perfect. That's a positive end. All right. That's a positive end that you can reverse. That basically at the end of the day, you still have control, right? You still have control. And I want to give people a sense of hope that all is not lost, that your life has purpose and meaning and your health is valuable, not only to you, but to your loved ones, to your community. So if you ever need any type of ongoing support or resources or access to qualified clinicians to help you along that journey, please reach out to me. I'm Pam Grace with Discover You Health, www.discoveryouhealth.net. I would love to be of support and help you navigate your health and help you reach your goals. And also, we have a 10% discount offering. So if you sign up for any of our chronic condition services or inquire on that and activate services, we'll be happy to offer you some financial relief of that as well. Okay. And in conclusion, thank you so much, Dr. Jasmine Abrams, for gracing me today and gracing us today with your beautiful presence, your light, your love, your knowledge, your wisdom. And I pray that all the ears that hear this message is touched in one way or the other. And how could they either reach you? What works do you have or projects, what you're doing? Let us know.
Yeah, so folks can follow me on social media at Dr. Jasmine Abrams. I believe that's the same for Facebook, Twitter, and Instagram. And you can also head over to my website, www.drjasmineabrams.com, to check out what I have going on. And thank you so much for having me, Pam Grace. It was a joy and an honor to be here.
Thank you so much. All right, y'all. Well, till next time, have a good one. I am